Hello, YouTube. Welcome to Rapid Nurse. Who am I? Just a nurse with years of nursing experience, making me a nurse of all trades, but a master of nothing. These rapid experiences in the healthcare field took a fresh-faced young nurse with boundless hopes for our healthcare and warped it into a tired old nurse with a jaded sense of humor. On the channel, we will discuss topics that affect our healthcare. Past, present, and future of surgery. What if you could heal from major surgery in just hours instead of weeks? Or imagine a time when surgical tools are too small to see with the naked eye, yet they perform life-saving operations inside your body. It might sound like science fiction, but the future of surgery is closer than you think. Stay with us as we journey through the fascinating evolution of surgery, from its beginnings to the cutting-edge technology shaping the future. By the end of this video, you'll appreciate how far we've come and be thrilled about where we're going. Stay tuned because we know you won't want to miss a second. Let's get started. The past, the brutal beginnings of surgery. Let's start by traveling back in time to the earliest days of surgery. It wasn't always the sophisticated practice we know today. Ancient surgery was often a last resort, fraught with danger and excruciating pain and often death. There was no anesthesia, antibiotics, or understanding of human anatomy. The earliest records of surgical procedures date back to ancient Egypt, around 3,500 years ago. These early surgeons were more like trial and error practitioners. They performed rudimentary operations such as trepanation, where a hole was drilled into the skull to treat head injuries or release evil spirits, as was commonly believed at the time. Without the knowledge of germs or proper sanitation, infections were rampant, and survival was far from guaranteed. Moving forward to the Middle Ages, surgery was still primitive and often carried out by barbers. Yes, you heard that right, barbers were the go-to professionals for surgeries, including amputations and tooth extractions. The red and white barber pole we see today represents blood and bandages as a sign of this bloody past. Surgeries during this time were swift and brutal, with patients often having to be held down as there were no effective painkillers. It wasn't until the 19th century that surgery began to change in a significant way. The discovery of anesthesia in the 1840s was a game changer. For the first time, patients could undergo surgery without the excruciating pain that had been a hallmark of the practice for millennia. Around the same time, the understanding of germs and the importance of sterilization began to take hold, thanks to pioneers like Joseph Lister. With the introduction of antiseptic techniques, the survival rates of surgical patients improved dramatically. As we moved into the 20th century, surgery continued to evolve with the development of new tools and techniques. The invention of the scalpel, sutures, and more sophisticated surgical instruments allowed for more precise and less invasive procedures. However, it's important to note that surgery was still a risky endeavor. Even with the advancements in pain management and sanitation, many surgeries were complicated, and recovery could be long and difficult. Those early surgeons, despite the limitations of their time, laid the foundation for the modern practices we benefit from today. But as we'll see, the journey was far from over. Grab a wheelchair and buckle up for an important message from today's video sponsor, Amazon. Are you tired of waiting weeks for your online orders to arrive? Well, say goodbye to those long delivery times and hello to the convenience of Amazon Prime. With Amazon Prime, you can enjoy rapid, fast delivery on millions of items right to your doorstep. Whether it's the latest tech gadgets, trendy fashion finds, or everyday essentials like the Saw franchise on DVD or Blu-ray. The best part is by using the Amazon affiliate link down in the description, you not only get access to all these amazing benefits, but you also support the Rapid Nurse channel. Every purchase made through our affiliate link helps us keep bringing you awesome content. Just imagine, you're sitting on your couch craving that new book everyone's talking about or wondering if you should get Dead by Daylight for your choice video game platform. Instead of waiting days for it to arrive, you can have it at your doorstep in just hours with Amazon Prime's same-day delivery. Let's not forget about the convenience. No more rushing to the store or dealing with crowded malls. With Amazon Prime, you can shop from the comfort of your own home, anytime, anywhere. So what are you waiting for? Click the link in the description below to start your Amazon Prime membership today and experience the convenience and the rapid speed of Amazon delivery for yourself. This video is sponsored by Amazon Prime. Click the link below to start your membership now. From the brutal beginnings to the development of anesthesia and antiseptics, surgery has come a long way. But what does surgery look like today? Let's look into the present to explore the cutting-edge advancements that are revolutionizing the field. The present, cutting-edge advances in modern surgery. Today, surgery is a marvel of precision, skill, and technology. We've moved far beyond the rudimentary practices of the past, thanks to incredible advancements in medical science. Modern surgery is not just about fixing what's broken. It's about doing so in the least invasive and most effective way possible. Let's take a look at some of the groundbreaking technologies and techniques that define surgery today. One of the most significant advancements in modern surgery is the development of minimally invasive procedures. Unlike traditional open surgeries, where large incisions are made, minimally invasive surgery involves tiny cuts, often just a few millimeters long. Through these small openings, surgeons can insert instruments and cameras to perform complex procedures. This approach has dramatically reduced recovery times, minimized scarring, and lowered the risk of complications. Robotic surgery is another remarkable innovation. Using systems like the Da Vinci surgical system, surgeons can perform highly precise operations with the help of robotic arms. These robots can make movements that are impossible for human hands, allowing for greater accuracy and control during surgery. Patients benefit from shorter hospital stays and quicker recoveries, while surgeons can perform complex tasks with greater ease and precision. The rise of imaging technology has also revolutionized surgery. Techniques like MRI, CT scans, and ultrasound have made it possible to visualize the inside of the body in incredible detail. Surgeons can now plan their operations with pinpoint accuracy, knowing exactly what they will encounter before making the first incision. This has led to better outcomes and fewer surprises during surgery. Another exciting development is the use of personalized medicine in surgery. By understanding a patient's unique genetic makeup, surgeons can tailor procedures and treatments to the individual. This personalized approach not only improves the effectiveness of surgery, but also reduces the risk of adverse reactions and complications. In addition to these technological advancements, modern surgery has also seen significant improvements in patient care. Enhanced recovery protocols, better pain management techniques, and more comprehensive pre- and post-operative care have all contributed to improved patient outcomes. Surgery is no longer just about the operation itself. It's about the entire patient experience, from diagnosis to recovery. The combination of cutting-edge technology, improved techniques, and a focus on patient-centered care has transformed surgery into a safer, more effective practice. But as impressive as these advancements are, the future holds even more exciting possibilities. We've seen how far surgery has come, from ancient times to the high-tech procedures of today. But what about tomorrow? The future of surgery promises to be nothing short of revolutionary, with innovations that could change everything we know about medicine. Let's take a look at the future of surgery and explore the mind-blowing potential of nanobots. The future, the revolutionary potential of nanobots in surgery. As we look to the future, one of the most exciting prospects in surgery is the use of nanotechnology, specifically nanobots. These microscopic robots, often no larger than a blood cell, could revolutionize the way we perform surgeries, making procedures safer, rapid, and more precise than ever before. Imagine a world where surgeries could be performed without a single incision. Instead of traditional tools, nanobots could be injected into the bloodstream, where they would travel to the site of a problem and perform the necessary repairs from within. These tiny robots could clear blocked arteries, repair damaged tissues, or even target and destroy cancer cells, all without the need for invasive surgery. One of the most promising aspects of nanobot technology is its potential for precision. Nanobots could be programmed to target only the affected areas, leaving healthy tissues unharmed. This level of precision would greatly reduce the risks associated with surgery, such as infections, scarring, and damage to surrounding tissues. Additionally, because nanobots operate at the cellular level, they can perform tasks that are currently impossible with conventional surgical techniques. The potential applications of nanobots in surgery are vast. For example, in cardiovascular surgery, nanobots could be used to break up blood clots or repair damaged blood vessels, reducing the need for more invasive procedures like open heart surgery. In oncology, nanobots could be employed to deliver targeted chemotherapy directly to cancer cells, minimizing the side effects of treatment and improving patient outcomes. Another exciting possibility is the use of nanobots in regenerative medicine. These tiny machines could help regenerate damaged tissues or organs by delivering stem cells or other regenerative agents directly to the site of injury. This could open up new avenues for treating conditions that are currently incurable, such as spinal cord injuries or degenerative diseases. Of course, the development of nanobot technology is still in its early stages, and there are significant challenges to overcome. Issues such as ensuring the safety and reliability of nanobots, as well as the ethical implications of their use, will need to be carefully considered. However, the potential benefits of this technology are so immense that it's hard not to be optimistic about the future. As we stand on the brink of this new era in surgery, it's clear that the possibilities are endless. The integration of nanobots into surgical practice could fundamentally change the way we think about medicine, shifting the focus from treating diseases to preventing them altogether. And while we may be a few years away from seeing nanobots in widespread use, the future of surgery is undoubtedly bright. We've traveled through time, exploring the fascinating evolution of surgery, from its brutal beginnings to the incredible technologies shaping the present and the mind-blowing future of nanobots. This journey shows just how far we've come and hints at the limitless possibilities that lie ahead. Surgery, as we know it, is constantly being redefined, and the future holds even more exciting and life-changing innovations. What are your thoughts on the future of surgery? Do you think nanobots will revolutionize the field, or is there another breakthrough you're looking forward to? We would love to hear your thoughts in the comments below. If you found this video informative, make sure to hit that like button, subscribe to our channel, and turn on notifications so you won't miss any of our upcoming videos. And if you know someone who would find this topic as fascinating as you do, share this video with them. Thanks for watching, and we'll see you in the next video. I find it interesting as time goes on and as healthcare rapidly changes, you took the time to view the video. You have my sincere gratitude. Thank you. Before I sign off, could I ask you to please like, comment, turn on notifications, and subscribe to Rapid Nurse. This will really help the channel get to the next level and ready this nurse for more content.